Welcome and thank you for standing by. At this time, all participants are in listening-only mode until the question-and-answer session of today's conference. At that time, you can press star one on your phone to ask a question. I'd like to inform all parties today's conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the conference over to Michael Cook. Thank you. You may begin.
Good morning, and thank you for joining us. I'm Michael Cook, Chief of the Public Information Office at the U.S. Census Bureau. Today, we are releasing the latest income, poverty, and health insurance findings for the nation. We'll have three presenters today to cover these topics. Immediately after the presentations, we'll open the phone lines to answer questions from reporters. This live question and answer session is for the media only. By the way, resources from today's news conference can be found on census.gov, including the slide decks from today's presentation. The deck will be part of the Income and Poverty Health Insurance Press Kit. To find the press kit, look for the Information tab at the top of the Census webpage and click on Media Newsroom. The press kits are located on the left side of the website. When you click on the press kits, you should find the Income, Poverty, and Health Insurance Press Kit at the top. Without further delay, I'll turn it over to Dave Waddington, Chief of the Social, Economic, and Housing Statistics Division. David?
Good morning. Thank you, Michael. Thank you for joining us today. Today we are releasing three reports: income, poverty, and health insurance coverage for the United States in 2021. These reports are based on the data from the Current Population Survey's annual Social and Economic Supplement to the CPS, or CPS-ASEC. Current Population Survey is the longest-running survey conducted by the Census Bureau and is the official source of the National Poverty Estimate. This year, for the first time, the estimates for the official poverty and the supplemental poverty measure are being released in the same report. Now, let's take a look at the main findings. Real median household income was $70,800 in 2021, not statistically different from the 2020 estimate of $71,200. Recessions, as defined by the National Bureau of Economic Research, are depicted in this and all time series charts in light shading. The official poverty rate in 2021 was 11.6%, with 37.9 million people in poverty. Neither the rate nor the number in poverty was statistically different from 2020. The Supplemental Poverty Measure, or SPM, extends the official poverty measure to include the value of non-cash benefits, stimulus payments, taxes, and other necessary expenses. The SPM rate in 2021 was 7.8%. This was 1.4 percentage points lower than 2020. The percentage of people with health insurance coverage for some or all of calendar year 2021 increased by 0.4 percentage points to 91.7. Now let's turn to our subject matter experts to take a closer look at the findings, beginning with Leanna Fox, who will present the main findings from the Income and Poverty Report. And as a reminder, immediately following the presentation, we'll take your questions.
Thank you, Dave. Good morning. Income and poverty statistics help us measure the economic well-being of the nation's population. Most of the income estimates in my presentation are based on money income, which is a measure of all cash or money resources coming into a household. It includes wages and earnings from work, as well as Social Security benefits, unemployment compensation, retirement income, interest, dividends, and public assistance. It is calculated pre-tax and therefore does not account for taxes paid or tax credits received, such as the Earned Income Tax Credit, or EITC, and the Child Tax Credit, or CTC. It also does not account for stimulus payments or non-cash assistance like SNAP, Medicaid, and Medicare. Let me begin by summarizing the main income, earnings, and work experience findings. Between 2020 and 2021, real median household income was not statistically different. Income inequality, as measured by the Gini Index, increased 1.2%. The number of total workers was not statistically different, but the number of full-time year-round workers increased by about 11.1 million. The real median earnings of total workers increased 4.6%, while median earnings of those who worked full-time year-round decreased 4.1%. Now let's take a closer look at these findings. This chart shows median household income from 1967 to 2021 in real inflation-adjusted dollars. This adjustment reflects a 4.7% increase in consumer prices between 2020 and 2021. The median is the point that divides the household income distribution into halves, one half with income above the median and the other with income below the median. Median household income was $70,800 in 2021, not statistically different than in 2020. Now looking at income by race and Hispanic origin. Asian households had the highest median income in 2021, followed by non-Hispanic white households and Hispanic households. Black households had the lowest median income. None of these estimates were statistically different from 2020. Although real median income did not change for all households and by race and Hispanic origin groups between 2020 and 2021, median household income declined for the following groups: non-family households, those with a householder age 65 and older, those maintained by a native-born person, and those with a householder with some college. The only major demographic group to experience an increase in median household income between 2020 and 2021 were householders with at least a bachelor's degree. Using information about the distribution of household income, we can produce a Gini index. This measures the amount that any two incomes differ on average relative to mean income. It ranges from 0 to 1. A value of 0 means that all households have equal income, and a value of 1 means that one household has all the income. The Money Income Gini Index was 0.494 in 2021, an increase of 1.2% from the 2020 value of 0.488. This represents the first time the Gini Index has shown an annual increase since 2011. The Gini Index is sensitive to changes in the upper and lower ends of the income distribution. In addition to looking at the median or 50th percentile, other points along the distribution can help explain why the Gini Index increased. For example, at the 10th percentile, 10% of households had income at or below $15,700 in 2021. At the 90th percentile, 10% of households had income above $212,000. Changes in these percentiles can offer insight into how income inequality increased. Income at the 10th percentile declined 4.4% between 2020 and 2021, although changes at the 50th and 90th percentiles were not statistically significant. This suggests that a decline in real income at the bottom of the distribution drove the increase in the Gini Index. As noted earlier, these estimates are based on money income before taxes and credits. However, an appendix to the report also looks at post-tax income. This analysis accounts for state and federal income and payroll taxes. It also accounts for the third round of stimulus payments and refundable tax credits such as EITC and CTC. Looking at this slide, we can evaluate changes in inequality using post-tax income. Using the same measures, we see no significant changes in inequality using post-tax income between 2020 and 2021, in contrast to the higher inequality observed using pre-tax money income. Given the progressive structure of our income tax system, it is not surprising to see less inequality using post-tax income. More details on inequality measures and post-tax income are available in the report. These next slides switch to earnings and work experience for people aged 15 and older. Earnings are the sum of wages, salary, and self-employment income. This comprised 78% of aggregate income in 2021. Total workers include both part-time and full-time workers. A full-time year-round worker is a person who worked at least 35 hours per week and at least 50 weeks per year. This slide shows the 2021 real median earnings of total workers and full-time year-round workers by sex. Between 2020 and 2021, the real median earnings of total workers increased 4.6%, while the median earnings of those who worked full-time year-round decreased 4.1%. To explain these seemingly contradictory results, we examine the composition of workers. Here we see historical data on the number of total workers and full-time year-round workers by sex. Between 2020 and 2021, the total number of male and female workers did not change significantly. However, the number of full-time year-round workers increased, for males by 6.1 million and for females by 5 million. This slide shows the change in the number of workers between 2020 and 2021. The increase of 11.1 million full-time year-round workers, coupled with no change in the number of total workers, suggests a shift from working part-time or part-year in 2020 to full-time year-round work in 2021. Adding in the percent change in median earnings from 2021 to the year prior, we see that the shift to more full-time year-round work corresponded with a 4.6% increase in real median earnings among all workers. On the other hand, real median earnings declined by 4.1% for those who worked full-time year-round. This may reflect inflation surpassing nominal gains in earnings, as well as the addition of full-time jobs in the lower half of the earnings distribution. Here we see historical median earnings of female and male full-time year-round workers. The ratio of these estimates is called the female-to-male earnings ratio. It was 83.7% in 2021. This means women earned about 84% as much as their male counterparts. The ratio for 2021 was not statistically different from 2020. The last time this ratio experienced an annual increase was in 2016. To find our full income report and additional resources, please visit our website. Now, let's turn our attention to poverty. The Census Bureau uses 2 poverty measures to describe who is poor in the United States, the official poverty measure and the supplemental poverty measure, known as the SPM. This is the first time both measures have been released in the same report. Here are the main findings from the poverty report. The official poverty rate in 2021 was 11.6%, with 37.9 million people in poverty. The SPM rate in 2021 was 7.8%, down 1.4 percentage points from 2020. The SPM rate for children was 5.2%, down 4.5 percentage points from 2020. Both the overall and child poverty rates are the lowest SPM rates on record. Refundable tax credits, including the child tax credit, kept 9.6 million people out of poverty in 2021. We'll begin by discussing the official poverty measure. The official poverty measure, which was established by the Office of Management and Budget's Statistical Policy Directive 14, is composed of money income, like the income estimates from the previous slides. The components of money income are shown again here. For this measure, the poverty threshold is adjusted for family composition, but does not vary by geography. In 2021, a family with 2 adults and 2 children was classified as in poverty if their income was less than $27,479. This slide shows the official poverty rate and number of people in poverty going back to 1959, the first year for which we have estimates. As you can see, the 2021 poverty rate was 11.6%, with 37.9 million people in poverty. Neither of these estimates were statistically different from 2020. This slide looks at official poverty rates by age. Between 2020 and 2021, rates decreased for individuals under age 18 to 15.3%. The poverty rate increased for those age 65 and older to 10.3%. In this slide, we look at official poverty rates by family type. The poverty rates for all primary family types in 2021 were not statistically different from 2020. Female householder families had the highest poverty rate at 23%, while married couple families had the lowest at 4.8%. Here we present official poverty rates for people by race and Hispanic origin. Most of these groups did not have significant changes in their official poverty rates from 2020 to 2021. The exception is for the Asian population, whose poverty rate increased by 1.2 percentage points. Of the groups in this figure, non-Hispanic white individuals had the lowest poverty rate at 8.1%. Black individuals had the highest poverty rate at 19.5%. Poverty rates for additional race and Hispanic origin groups are available in the report. Now let's turn to the supplemental poverty measure. In addition to resources captured by the official poverty measure, the SPM includes non-cash benefits from government assistance programs, including housing, utility, and nutritional assistance programs, and subtracts taxes and necessary expenses, such as work, childcare, and medical expenses. The SPM thresholds are produced by the Bureau of Labor Statistics using Consumer Expenditure Survey data. Separate thresholds are created for renters, homeowners with a mortgage, and those who own their homes free and clear. While the official poverty threshold is constant throughout the United States, The SPM adjusts for geographic differences in housing costs. This map shows those adjustments, with yellow areas having lower thresholds for renters than the official poverty threshold, and blue and green areas having higher thresholds. This slide compares SPM estimates for 2020 and 2021 for all people and by age group. The SPM rate in 2021 was 7.8%, down 1.4 percentage points. The SPM child poverty rate was nearly cut in half in 2021, falling from 9.7% to 5.2%. SPM rates also declined for those aged 18 to 64 to 7.9%. The SPM rate for adults aged 65 and older increased to 10.7%. This slide shows SPM rates by race and Hispanic origin. In 2021, the SPM rate was 11.3% for Black individuals, 11.2% for Hispanic individuals, and 5.7% for non-Hispanic white individuals, all representing declines from the previous year, as well as the lowest SPM rates on record. The SPM rate for Asian individuals was 9.5%, not statistically different from the year before. SPM estimates can be compared to the official measure from 2009 to 2021. In 2021, the SPM was 3.8 percentage points lower than the official measure and was the lowest SPM rate on record. The differences between two poverty measures are especially apparent for children. In 2021, the gap between the official and SPM rates for children grew to 10.1 percentage points. This is the largest gap between the measures and the lowest SPM child poverty rate on record. The increased difference in poverty rates for children reflects the impact of the child tax credit, which was made fully refundable for 2021. Now let's look at the difference in poverty rates by geography. While the SPM national poverty rate was lower than the official poverty rate in 2021, that difference varied by geographic area. This figure shows the United States divided into three categories by state. There were 3 states where SPM rates were higher than official. These are shaded blue. There were 38 states where the SPM was lower than official. These are shaded orange. And finally, there were 9 states plus the District of Columbia where the differences in the rates were not statistically significant. These are gray. One important contribution that the SPM provides is allowing us to gauge the effectiveness of tax credits and transfers in alleviating poverty. We can also examine the effects of necessary expenses like work and medical expenses. This figure shows how the number of people in SPM poverty changes if we add or subtract a single resource element for the overall population and by age. Some of these elements, like Social Security and unemployment insurance, are included in the official poverty estimates. Others, like stimulus payments and refundable tax credits, are included only in the SPM resource measure. Using this chart, we can see that 26.3 million people were taken out of poverty by Social Security benefits. Most of these individuals were aged 65 and older. 9.6 million people were taken out of poverty by refundable tax credits. Of these, 4.9 million were children. Specifically, the child tax credit lifted 5.3 million people out of poverty in 2021. Lastly, subtracting medical expenses increased the number of people in poverty by 4.7 million. To find our full poverty report and additional resources, please visit our website. Next, Sharon Stern will summarize the findings for health insurance.
Thank you, Liana. Health insurance coverage is an important measure of our nation's overall well-being. Whether it's for illness, injury, or preventive needs, health insurance provides greater access to medical care, protection from high unexpected costs, and more economic stability. Each year, the Census Bureau provides data on health insurance coverage. We look at who is and isn't covered and what type of insurance they have. All of the health insurance estimates released today come from the CPS ASEC, which asks people about their health insurance coverage at any time in the previous calendar year. Let me begin by summarizing the main findings this year. An estimated 8.3% of the population, or about 27.2 million people, did not have health insurance coverage at any point in 2021. The uninsured rate decreased by 0.4 percentage points, or by 1.1 million people. In 2021, most people, 91.7%, had health insurance coverage at some point during the calendar year. People are counted as insured if they had coverage at any time during 2021. 66% of people held private coverage. Employer-based coverage was the most common subtype, covering 54.3% of the population, while 10.2% of people purchased their coverage directly. 35.7% of people had public coverage, which includes Medicare, Medicaid, and VA and CHAMP VA. It's important to note that some people may be counted in multiple categories if they held different types of coverage during the year. The chart on the right shows the change in health insurance coverage between 2020 and 2021. The increase in the percentage of people covered by any type of health insurance was driven by a change in public coverage. The percent of people with public coverage increased by 1.2 percentage points, whereas over the same period, the percentage of people with private coverage decreased. Among public coverage types, Medicaid coverage increased 0.9 percentage points, and Medicare coverage increased by half of a percentage point. Note that the increase in Medicare was partly due to growth in the number of people age 65 and over, and not a change in Medicare coverage for adults in the same range. Changes in health coverage from year to year reflect changing economic conditions, but also demographic shifts such as population aging, and policy changes at the federal and state level that affect access to care. For instance, health insurance coverage rates may have been affected by the 2020 economic recession and the ensuing recovery. Additionally, recent policy changes to address the public health emergency may have affected health insurance coverage. Age is strongly associated with the likelihood that a person has health insurance. This is because children under the age of 19 may qualify for certain programs, such as the Children's Health Insurance Program, or CHIP, for which working-age adults are not eligible. In addition, most adults aged 65 and older are covered through Medicare. The uninsured rate was lowest for those aged 65 and older, followed by the rate for children under age 19. The only age group with a statistically significant change was children under 19. Their uninsured rate fell to 5.0%. In addition to age, family resources may determine whether a person has health insurance coverage. Here we take a look at how family resources interact with broad age categories. For every income to poverty group, adults are more likely to be uninsured than children. For example, 24% of adults in poverty were uninsured for all of 2021, while only 8.3% of children in poverty were uninsured. For most of the groups shown in this chart, apparent differences were not statistically significant. Of note, the uninsured rate for children in families with incomes at or above 400% of their poverty threshold fell to 1.7% in 2021. Now let's take a look at private coverage rate for the same age and income to poverty groups. Both adults and children in higher income to poverty categories are more likely to be covered by private health insurance, and adults and children in poverty are the least likely to have private health insurance. There were not many changes in private coverage among these groups, except for children in the middle category. Private coverage declined to 53.4% in 2021 for these children. We see a different story for public health insurance. Children and adults living in poverty are the most likely to have public health insurance, while those in higher income to poverty categories are less likely to have public health insurance. For most of these groups, public coverage rates increased between 2020 and 2021. Only the apparent difference for children in poverty was not statistically significant. Under the Patient Protection and Affordable Care Act, some states expanded Medicaid eligibility to people whose income to poverty ratio falls on a particular threshold. As of January 1st, 2021, 36 states and the District of Columbia had expanded Medicaid eligibility requirements, labeled here as expansion states. 14 states had not. They're labeled non-expansion states. This slide focuses on health insurance coverage for children by the state's Medicaid expansion status. For children living in expansion states, shown on the left, a decrease in private coverage was offset by an increase in public coverage, resulting in an uninsured rate that was not statistically different between the 2 years. For children living in non-expansion states, shown here on the right, we see a decrease in the uninsured rate, which was 7.1% in 2021. This slide shows health insurance coverage for adults based on their state's expansion status. As shown on the left, the story for adults is similar to that for children in these states. Compared to the previous year, the private coverage rate was lower, the public coverage rate was higher, and the uninsured rate was not statistically different. For adults living in non-expansion states, shown on the right, there was a decrease in the uninsured rate by 1.0 percentage points, driven in part by the increase in public health insurance. As mentioned earlier, the composition of the workforce changed between 2020 and 2021. This chart on the left shows the shift Liana mentioned earlier for our health insurance universe of adults 19 to 64. Specifically, there was an increase in the number of full-time year-round workers and a decrease in the number of people working part-time or part-year. This figure shown on the right shows the uninsured rates for these work experience groups. In both years, full-time year-round workers are less likely to be uninsured than other workers and non-workers. In 2021, the uninsured rate increased to 9.1% for full-time, full-year workers. For those who worked less than full-time, full-year, the uninsured rate decreased to 15.1%, a 6.1 percentage point difference between the two groups. Some of this difference is likely due to changes in the composition of the workforce. More information is available in our report, supplemental tables, and America Count stories. Now I'll turn it back to David Waddington.
Hey, Dave, you need to unmute.
Yeah, thank you, Sharon and Liana. That concludes our presentations for today. To recap the highlights, real median household income was $70,800. The official poverty rate was 11.6%. The supplemental poverty rate decreased by 1.4 percentage points to 7.8%. And the percentage of people with health insurance coverage for some or all of the calendar year increased and went to 91.7%. These findings reflect several factors affecting households during 2021. These include the continued response to the COVID-19 pandemic, rising inflation, shifts in the composition of the workforce, policy changes, and other macroeconomic conditions which shaped the experiences of households in 2021. More information is available in our reports and online. Each year, we release hundreds of detailed tables and historical tables, as well as several information products. Last week, we released blogs on the difference between official poverty and the SPM and how inflation affects some income estimates. And today, we released a Research Matters blog that evaluates survey non-response using administrative data. We are also releasing a number of America Count stories that go into more detail about specific issues. These include stories on income inequality, the impact of the child tax credit and government assistance on poverty, and insurance status for children and full-time year-round workers. Lastly, I want to remind you that for the past several years, the Census Bureau has been discussing a possible change in the index used to adjust previous year's income estimates. For the past 3 years, we have published alternatives in an appendix to the income report. There was also an interagency technical working group that made recommendations on this topic. More information about the proposed change will be found on our website or in the current Federal Register notice that you can see the link to on our slide here. The Census Bureau welcomes feedback and advice from our data users. And now I'll turn it back over to Michael for our question and answer session.
Thanks, Dave. We'll start taking questions now. To fit in as many questions as possible, reporters can ask one question and one follow-up. Operator, can you please give instructions on how reporters can submit their questions?
Yes, thank you. We will now begin the question and answer session. If you'd like to ask a question, please press star 1, unmute your phone, and record your name clearly. Your name is required to introduce your question. If you need to withdraw your question, press star 1, or star 2, sorry, to withdraw your question. Again, to ask a question, press star 1. Take a few moments for the questions to come through. Please stand by.
While we wait for the first question to queue up, a reminder to check out the electronic press kit on census.gov. It contains a wealth of resources, including today's news release, the full reports on income, poverty, and health insurance, graphics, fact sheets, several American Account stories, blogs, working papers, today's slide deck, and last but most important, the actual data. Today's news conference will be posted in the next 48 hours or so. I'd also like to note some major releases and events we have coming up this month. This Thursday, the 2021 American Community Survey one-year estimates will be released. The embargo starts today. Check out our website for more details on that. The American Community Survey is the premier source for detailed population and housing information about our nation. And then next week, we will release data on the domestic migration of older adults. Also next week, we'll hold an event in Hartville, Missouri to mark it being named the Center of Population based on data from the 2020 census. We should be ready to begin taking questions. A note, if you are asking a question, be sure to mute your computer monitor to avoid getting any feedback. Operator, do you have our first question?
Yes, our first question is from Selena Simons-Tuffin from NPR. Go ahead, your line's open.
Hi, Selena.
Hello. Hi, thanks for doing this. I'm interested in the health insurance numbers, and my understanding is that the uninsured rate is at a historic low. Can you confirm that that's true?
Thanks for that question on health insurance. And I'll toss that over to Sharon Stein.
Hi. We have done the statistical test, and it is not lower than the 2017 rate of 5%, so it is not statistically different. That said, comparisons over time, you always need to be aware of difference in measurement and whatnot. So it's certainly among the lowest.
Thanks for that, Sharon. And operator, do we have our next caller?
And our next question is from Tammy Lubel from CNN. Go ahead, your line's open.
Hey, Tammy.
Good morning. Thank you for holding this. My single question is just to confirm, is the SPM data, when you say on record for children and such, is that since 2009, I assume?
Thanks for that question on the SPM, and in particular on children. Looking back at 2009, and to address that question, I'm going to turn it over to Liana Fox. Liana?
Hi, Tammy. That's correct. The SPM goes back to 2009. We began publishing estimates in 2011, going back to 2009. So when we say on record, it's just this time series.
Okay, and then my second question is, to what extent did the child tax credit bring down the SPM? Would you say it was fully responsible for bringing it down, or in large part?
It's a major contributor. So the child poverty rate fell from 9.7% to 5.2%. In the absence of the child tax credit, we would have had poverty only falling from 9.7 to 9.2%. So 4 percentage points of the 4.5 percentage point decline are due directly to the child tax credit. And we have an American Account story today released that goes into more depth on the impact of on child.
Thank you for publishing that.
Thanks for that, James. Thanks for those questions. Operator, do we have our next caller?
Our next caller is Dan Burns from Reuters. Go ahead, your line's open.
Hey,
yes, I think. Thank you. I think this is also for Liana. At some point, you mentioned a figure of 9.6 million people lifted out of poverty over under the SPM measure. Over what, did I hear that correctly, and over what time frame was that, and what were the contributors to that?
Sure. Sorry, I'll go ahead and jump in. This is Leanna Fox. Thanks, Dan, for your question. So this figure shows if we were just to net out the single component. And here we're subtracting out refundable tax credits, which includes the earned income tax credit, the child tax credit, and the child independent care credit. So that reduces the number of people who would have fallen into poverty by 9.6 million people.
And that was just in 2021 from 2020?
Correct. This is just in 2021. So within 2021, the inclusion of refundable tax credits in our poverty measure decreases the number of people by 9.6 million.
Thank you.
Thank you. Thanks for that, Dan. Operator, do we have our next question? Next caller?
Yes, our next question is from Olivia Winslow from Newsday. Go ahead, your line's open.
Hi, Olivia.
Hi, thank you for taking my call. To what extent would you say these measures, the median household income are affected by, and the poverty rate are affected by the pandemic? Or what's the impact of the pandemic on these statistics, principally income and poverty rate?
Thanks for that question on pandemic impacts on income and poverty. Olivia, I'll turn that over to Leanna Fox, and also if Dave wants to chime in, he'll jump on as well. Leanna?
Yeah, I mean, I can start off on that if Leanna has some more too. I mean, we can't really differentiate exactly what's caused by the pandemic. There's been lots of policy changes in response to the pandemic that have driven some of these things, like Leanna was talking with the child tax credit and some of the changes in the recovery activities. So it's hard for us to differentiate exactly, to put a cause on one thing or the other. We really can't do that.
I would agree with that, and I would just add we have another America Counts story that looks at the total impact of government that will be released today. So it'll include the total impact of social safety nets, but there are a lot of factors influencing the results that we see today.
Thank you.
And thank you. Operator, our next caller.
Again, as a reminder, please press *1 on your phone, record your name if you have a question. Our next question is from Janet Wixom from University of Massachusetts Amherst. Go ahead, your line's open.
Hi, Janet.
Hi. Can you talk about any of the data collection challenges and measurement issues created by the pandemic and any differences between 2020 and 2021?
And thanks for that. Again, a question about the pandemic and impacts specifically on measurement. And I'll toss that back over to David.
Yeah, so sure. I mean, there's, as you're aware, we've talked about in the previous couple of years of collection, the pandemic had a pretty substantial impact on our data collection during 2021 and 2020, particularly when we there was the overall shutdowns of a lot of things and we weren't even going door to door at all. So that had a pretty substantial impact on response rates. In 2021 and then this year we also had, there's still some residual impacts. We had a slight recovery last year and this year back down a little bit. We do have some information in the America Counts story out there that looks at the non-response bias that connected with that, and it does some analysis using administrative records data. I think one of the key points to make, though, is that there was not a substantial difference in what we saw last year to this year. So the comparisons that we're making should be pretty valid. Anything that we've seen before is comparable between the years.
Thank you.
And thanks for that. Operator, do we have our next caller?
I show no further questions at this time.
Okay. Before we wrap up, I'd like to remind, again, and I'll come back to you, Operator, see if we have any other callers before we wrap, just in case people want to get back in the queue. I'd like to remind everyone again about some of the major data releases and events we have coming up. Again, this Thursday, the 2021 American Community Survey one-year estimates will be publicly released. Again, the embargo is already underway for media. You can log on to census.gov to access the data, and next week we'll release data again on the domestic migration of older adults. And then next week, also, we will be holding an event in Hartsville, Missouri to mark it being named the Center of Population based on data from the 2020 census. Operator, do we have any more callers?
Yes, we have a question from Dan Burns from Reuters. Go ahead, your line's open.
Hey, Dan.
Thanks for calling
back in.
Sorry to jump in. Just as a follow-up to the question I had on the supplemental measure, given that most of those programs expired over the course of 2021, would you expect to see a level like this replicated next year and going forward, or will the supplemental rate begin to look more like the official headline rate, you think?
Thanks for that, Dan. I know that you're talking about hypotheticals, but I'll turn that over to Dave Waddington to give you some sound on that.
I think maybe, yeah, I'm going to let Liana respond to that. Sorry.
Hi, Dan. This is Liana. So we can't really speculate on what happens in 2022. 2022 is not even done yet. We haven't collected the data yet. I can say that we do look in one of the American Account stories on the CTC, and we look at what was the impact of the expansion, so not just the total impact, but like if we had gone back to the policies of 2020, what would poverty have been? So that information is out there. Otherwise, we'll have to wait until we collect data next March to see what we expect to see.
Thanks for that. And operator, as we look to see if there's anyone else in the queue, just a quick reminder or flag for those who might be on our website looking for those American Account stories that keep coming up time and time again. We are in the process of posting them, and they should be posting very soon in rapid fashion. Operator, do we have any other reporters or media on the line with questions?
Yeah, our next question is from Tammy Luby from CNN. Go ahead, your line's open.
Hi, thank you for taking up. Hi again. Thank you for taking another one of my questions. To what extent would you say the increase in the the ACA subsidies played into reducing the uninsured rate compared to Medicaid? It looked like, based on your numbers, Medicaid clearly went up by a lot, but the ACA coverage, I don't think, was statistically different.
Thanks for that line of question on health insurance, and in particular the impacts of ACA coverage. For that line of question on health insurance, I'm going to turn it over to Sharon Stern and she pulls out the information related to that. Sharon?
Hello. Thank you for that question. It's true, a lot of different factors can affect health insurance coverage, and there was a clear indication of increased public coverage. Looking at overall our marketplace coverage, that's where I think you're talking about, where we divide our direct purchase. Oh, good, thank you. Here it is on the screen. You can see it was not statistically different. If you dig down into the data, as I'd be happy to help you explore the report afterwards, there may be some groups for whom there was a difference in direct purchase. But overall, what we see is a clear indication regarding Medicaid and public coverage, and not statistical difference to direct purchase, which is, I think, where your question lies.
Yes, thank you. I was rather inarticulate.
Thanks for that.
Let me just add, Michael, if I can just add one more piece of that. I think some of the policy changes we've mentioned, too, is that with the pandemic and national emergency, there was restrictions on letting people get off of Medicaid. So although we may have had more people coming on, we didn't have people going off of Medicaid. So that's something else that may contribute to that.
Thanks for that, everyone. Operator, are there any other callers? Any other questions? Operator, are there any other questions?
Yes, our next question is from Leah Waters from Dallas Morning News. Your line's open.
Leah.
Hi, good morning. Yes, hi. I have a question. So I want to make sure I'm understanding this right, that the childhood poverty fell, but poverty among those 65 and older increased. And you did attribute that one of the main reasons that childhood poverty fell was because of the child tax credit. Can you give us any indication for why there was an increase in poverty rates among people 65 and older? Is there any sort of measure or anything that you can attribute that to?
Thanks for those line of questioning on poverty, and in particular how it impacted the 65 and older population. I'll turn that over to Leanna Fox.
Hi, Lee. Thanks for your question. So when we look at the 65-plus population, a larger share are on fixed incomes, and I think one thing that's very likely happening is that they're on fixed incomes that aren't keeping pace with inflation, and that's why we see an increase in their poverty rates.
Great. Thank you so much.
All right. Great. Good. Operator, any other callers?
I show no further questions at this time.
All right. Well, it looks like that's going to wrap us up. I would like to make a final note, and I know that we have plugged and talked a little bit in expense about the upcoming American Community Survey one-year estimates release that is going into embargo today, and then next week's domestic migration of older adults release, and also the event in Hartville, Missouri, marking the center plot based on data from the 2020 census. Finally, if there are any additional questions after today's news conference, or you'd like to arrange an interview with one of our subject matter experts, please call or contact the Public Information Office at 301-763-3030 or email us at pil@census.gov. I'd like to thank today's presenters, David Waddington, Sharon Stern, and Leanna Fox. I'm Michael Cook. Thank you for joining us for today's news conference on income, poverty, and health insurance. Have a great rest of your day, everyone. Thank you.
Thank you. That concludes today's conference. Thank you for participating. You may disconnect at this time.